Hi, this is Dr. Harris Jensen, and just a note on me helping healthcare providers. This past week, a healthcare provider came into my office and she was going to quit her career. She misinterpreted negative feedback from her administrator. I pointed out they can have all sorts of vested interests they don't talk about. She shouldn't base her career interests or her self-evaluation on administrators. And so she didn't quit her healthcare career, she stayed with it. So this is the kind of service a psychiatrist can provide because we've worked in hospitals, clinics, many different institutions. We're aware of the politics that can go on. Healthcare providers, nurses, doctors, physician assistants, nurse practitioners, therapists, they can get bad reviews because of things they're not told about. Maybe the hospital income is down, they need to downsize. Maybe they hired too many people and need to let someone go, and they're going to let people go who have a higher salary, but they're not going to say that. And other cases might be just, who knows, the administrator just had a bee in his bonnet. Another situation can be a provider is being asked to let go because they say they have a bad performance record, but nobody shows them the record. So this is just smoke, and that's happened to me before. You can be asked to let go because they just want somebody new, or it would look good for the administrator if they hired somebody new, then he could say he was doing something. That's how they get raises and promotions. They don't get necessarily raises because they're doing what another doctor said or another nurse said. Then it's their idea. That's feedback from a friend of mine who's a doctor whose dad has been an administrator in hospitals in another state. And so there can be lots of office politics. And if you don't know what's going on behind closed doors, you might take their feedback personally. And that certainly happened to me. I worked in 19 different hospitals before I went into private practice. I probably got bad feedback in a third of them, and none of it was documented. And so I took it personal until later I thought, what? Why didn't they show me evidence? Where's the facts? And so this was just politics, which goes on in every business, in every country, throughout the world. I'm not saying hospitals are bad, or there's, some sinister thing going on in healthcare. Every business has differences of opinion. Every business has administrators whose job it is to control people and make the bottom line look good. Entire hospitals have gone broke, and then everybody lets go. I've read stories about this happening in the East Coast, also in Colorado, for sure. So, administrators have a tough job. Doctors and nurses do too. I don't think we need to point fingers, but just understand there can be lots of hidden motivations in terms of the feedback a healthcare provider is getting. And the challenge then is for another healthcare provider who's been there to hear them out. So a healthcare provider should have a private, protected venue like a psychiatrist's office where they can ventilate, get all the stress off their chest, and then later search for a different perspective, a different understanding, a different point of view, and one that doesn't necessarily put down the healthcare provider, but acknowledges their skills, their initiative, their track record. And so, there's an old saying, it takes one to know one. So a number of doctors through the years have given me feedback. Thanks so much, Dr. Jensen. You really validated that I was doing a good job, and most of the criticism was not valid, but now I understand kind of how the system works, what might be people's different perspectives that they're not talking about because it might make somebody look bad, what might be their vested interests. And at the end of the day, a healthcare provider should be guided by the light of their own understanding, their own wisdom. With one provider, I asked, what do your patients say about how they feel about their treatment from you? And the providers said, well, they're really happy. I'm diagnosing and treating conditions. They're getting better with their chronic pain, insomnia, asthma. And so I said, well, there you go. That's your expert feedback. Those patients understand the interaction better than some administrator. And so there's no cause for self-doubt. Stay with your career. You're a good person. You've worked long and hard to get to where you're at. You're doing a good job. And the people who are criticizing your poor performance, my guess is they don't know what it is. They haven't talked to your patients. They haven't reviewed the chart. And if they did, why aren't they getting back to you with specifics? Oh, on this date, the outcome was bad. Asthma was worse. Here's the breathing test, the airway study. Yeah, they never get feedback like that. It's just performance. Some enigmatic phrase that can mean anything under the sun. So, working with a psychiatrist, you get a deeper perspective, a wiser, more insightful perspective, one that can preserve a healthcare provider's dignity and even their ability to support their family and sustain their career. So this is Dr. Harris Jensen with a little inside look at how psychiatrists can support other healthcare providers. Happy Thanksgiving.